If you have new itching, burning, odor, or discharge, it is usually one of three things: bacterial vaginosis, yeast infection, or trichomoniasis. The problem is that symptoms overlap, so guessing wrong is common, and it is why people keep treating yeast while the real issue is something else: what acute vaginitis is and what it feels like. Acute vaginitis means inflammation and irritation of the vagina and vulva, often from infection or irritation. Common symptoms: itching, burning, irritation. Discharge change, amount, color, texture. Odor: pain with sex, burning with urination, often external. Myths about vaginitis: if it itches, it's yeast. Not reliably. Bacterial vaginosis, trichomoniasis, irritation, and dermatitis can itch too. Bacterial vaginosis means cheating, and it's always a sexually transmitted infection. Wrong. Bacterial vaginosis is linked with sexual activity for some, but it is not proof of infidelity. Douching helps. In reality, often worsens irritation and disrupts vaginal balance. One OTC product fixes everything. Not true. OTC antifungals treat yeast, not BV or Trich. If symptoms improved, the infection is gone. In fact, Trich especially can recur without partner treatment. A symptom pattern can suggest a cause, but it doesn't prove it. The big three causes: 1. Bacterial vaginosis, BV. What it is: a shift in vaginal bacteria, not too dirty, not necessarily an STI. Typical clues: thin gray-white discharge, fishy odor, often worse after sex. Treatment is recommended when symptomatic. Standard regimens include metronidazole, oral or vaginal gel, or clindamycin cream. 2. Yeast, vulvovaginal candidiasis. What it is: Candida overgrowth. Typical clues: intense itch, burning, thick, curdy, cottage cheese, discharge, red, swollen vulva. CDC notes short-course azoles work for uncomplicated cases. Severe cases need longer therapy or repeat dosing. 3. Trichomoniasis, Trich. What it is: a sexually transmitted infection, protozoa. Typical clues: frothy discharge, irritation, sometimes odor. Can be mild or asymptomatic. Treatment for women: metronidazole 500 mg twice daily for 7 days, shown to outperform single dose for many women, and partners should be treated to prevent reinfection. The big three causes are bacterial vaginosis, yeast infection, and trichomoniasis, and sometimes more than one can be present at the same time. Other important causes people miss, especially if treatments keep failing: cervicitis from chlamydia or gonorrhea can look like vaginitis, abnormal discharge, bleeding after sex, pelvic discomfort. Chlamydia is commonly treated with doxycycline for 7 days, gonorrhea with an intramuscular ceftriaxone injection. Genital herpes, burning plus painful blisters or ulcers. Antivirals can shorten the course. Irritant or contact vaginitis. New soap, scented wipes, douching, lubricants, condoms, detergents. Genitourinary syndrome of menopause, atrophy, also called GSM. Dryness and burning, recurrent irritation and UTI-like symptoms. Options include moisturizers and lubricants, and vaginal estrogen, vaginal DHEA, or ospemifene. Disquamative inflammatory vaginitis, DIV, or aerobic vaginitis, less common. More inflammation, pain, discharge. Often needs clinician diagnosis. Initial therapy commonly involves intravaginal clindamycin and/or hydrocortisone. Retain foreign body, tampon, strong odor and discharge. What to do in the first 24 to 48 hours. While you are figuring it out, pause sex or use condoms until symptoms are treated and cleared. Gentle hygiene only. Water plus a mild unscented cleanser externally. Avoid douches, scented products, and detox suppositories. If painful, cool compresses and loose cotton underwear. The goal is simple. Calm the irritation and do not do anything that makes it worse. If it's BV, common options are metronidazole by mouth for 7 days or vaginal gel for 5 days, or clindamycin vaginal cream for 7 days. Quick note, some clindamycin vaginal products can weaken latex condoms for a short time. Follow the label. An alternative is single-dose secnidazole. For metronidazole, older advice said no alcohol. CDC says a true disulfiram-like reaction isn't well supported, but many people still feel nauseated, so some avoid alcohol anyway. If it's yeast, treatment is usually topical azoles or fluconazole. Severe cases may need a longer course or repeat dosing. If it's recurrent or resistant, clinicians may use newer options like ibrexafungerp or oteseconazole, only for people not of reproductive potential. If it's Trich, women are treated with metronidazole for 7 days, and partners must be treated. Avoid sex until treatment is finished and symptoms resolve. If it's cervicitis from an STI, chlamydia is treated with doxycycline for 7 days. Gonorrhea with intramuscular ceftriaxone. This requires testing and targeted treatment. Different problem, different medicine. If OTC yeast treatment doesn't clearly fix it, stop guessing. Get tested and treat the right cause. OTC can help, but only if you match it to the right problem. If you strongly suspect an uncomplicated yeast infection, classic intense itch plus thick, white, curdy discharge, and you're not pregnant and it's not recurrent, an intravaginal azole like miconazole or clotrimazole can be reasonable. Boric acid is sometimes used for recurrent or hard-to-treat yeast, typically 600 milligrams vaginally in a capsule, but only with clinician guidance. Do not use if pregnant, and never take it by mouth. Probiotics, especially lactobacillus-based, may help support normal vaginal flora and possibly reduce recurrences for some people, but think of them as an add-on, not a cure for BV or Trich. For symptom relief, you can use external-only anti-itch or numbing creams on the vulva. Products with benzocaine or resorcinol sometimes also include menthol or soothing moisturizers. This is short-term relief, not a fix. If this is your first episode, you're pregnant, you have fever or pelvic pain, sores, strong odor with possible retained tampon, or symptoms keep coming back, skip guessing and get tested. Bottom line, vaginitis is common, treatable, and not something you should suffer through. The win is matching the right treatment to the right cause, BV, yeast, Trich, or something else.